Jackie Dean.
Mr Speaker, it's good to get to this final reading of the Health Practitioners Replacement of Statutory References to Medical Practitioners Bill. And if I think about the health needs of my large, diverse constituency, it is becoming very apparent that the way we deliver health service in New Zealand needs to rapidly change and is rapidly changing. And if we are not to leave smaller rural communities behind in terms of healthcare, then we do need to change the way that health is delivered. And at the same time, the scope of practice of many medical staff, and whether it's doctors, nurses, other clinicians, their scope is widening and strengthening, and so those factors are now coming together in the provisions around this bill, which is a cognate bill to deal with 8 different pieces of law. We've had a number of readings for this, so I don't propose to go into those 8 pieces of legislation. But in amending those 8 statutes, we do enable a wider range of suitably qualified health practitioners, and I will pause just there to also say that those practitioners will be suitably qualified. This bill won't pose an increased risk of harm to the public with the scope of practice widening, because those scopes of practice are set with the relevant responsible authority, and the professional accountability of each of those practitioners is to the responsible authority, which is established under the Health Practitioners Competence Assurance Act. And so it is good news that the scope of practice is being strengthened and broadened, but we do have that assurance that there will be no increased risk of harm to the public. I was delivering a lecture to some final year nursing students in Christchurch a little while ago, and I was excited to see how much they are looking forward to this new environment upon the passage of this bill, and also other provisions and focus on health and primary care that this government has brought to health in New Zealand, the excitement of those students to move into employment with those increased responsibilities, but increased opportunities for them. So benefits to patients in all corners of New Zealand, benefits to health practitioners. With those words, I commend the bill to the House.